Hi, it's Jenny B, NSWOC. Today I want to talk about another common foot problem that I do see that sometimes people think are a diabetic foot ulcer, but they are not. It's actually something common that happens with people that ingest high purine foods, and it's called gout. Gout is something that happens again when we're eating foods like red meat, a lot of shellfish or fatty fish. We're also people that consume a lot of beer or diet drinks, diet pop, something that contains fructose or a fruit sugar. So this high uric acid level will accumulate and crystals will form in the joints. In the first stages of gout, again, you're just going to see where they're going to start to float around, and one of the biggest indications that you're developing gout is a high uric acid level. Usually it's over 500, 520, there's definitely a line, but if you're having high uric acid levels, this is something that your doctor, it's a blood test your doctor can do, and it will tell them whether or not this is something you're developing or at risk for. You can also get very inflamed and reddened joints as this is happening. And again, it will kind of exacerbate and continue to worsen throughout your life. There are 4 stages. As I said, the very first is where the uric acid levels are just elevating your blood and giving us a clue that, we maybe need to cut back on those types of foods. As I said, red meat, shellfish, diet pops, and beer, to be able to, reduce that so that it doesn't become an ongoing issue. After that, what will happen, and if they don't stop consuming some of these foods, is they will actually have an acute attack, which is where that redness and swelling comes in, and it's super painful. So the treatment for gout, for the most part, we're always, going to try to assume that we're going to give the least of all evil. So we usually start with a medication called colchicine. It does have a loading dose of 1.2 milligrams, and then we would give them a daily dose of 0.6 milligrams, for up to 10 days or so. Now, if this does continue to progress, they may need to have a larger anti-inflammatory that's going to help, suppress or reduce some of these uric acid levels, or at least the inflammation associated with the gout. Because after your first attack, again, there's usually a period of latent phase where there's a lot of remission in between. So again, the remission can be because we are giving some medications such as indomethacin or allopurinol. Allopurinol is a very common one. We're giving anywhere from 100 to 300 milligrams of that on a daily basis, depending on how severe it is. But then it can actually develop into what we call tophi. So I'm going to show you, this is actually an anatomical picture of what tophi is. But there's lots of pictures on the internet. This is a very common one that you can see here, where in the joints there's this little white nodules that form. I've seen them on many patients, and they can be this large or they can be much smaller, like they are on this foot here. There's also these are just ones I'm pulling off the internet. I'm trying to find some on the foot. So yeah, you can quite commonly see them in the toes like this. And this is actually where the gout has progressed and the uric acid has built up now around the joint, but now into the tissues. The most common reason I see this is that somebody's the nodule has gotten knocked off, or again, I see them with this toe and inflammation, and they may be diabetic as well, and they go, this might be a diabetic foot ulcer. So one of the first tests I do is to test if they have uric acid. Now, if I do see that they have tophi, the uric acid level isn't actually accurate or valid because, well, all the crystal and the uric acid is actually in the tophi. So it's accumulated there and in the joint, and they're not having these levels high in their blood any longer. So if these do become infected, one of the reasons I can also distinguish between gout versus a diabetic foot ulcer is when these tophi open, the crystals are actually white. They actually have a cottage cheese-like appearance when they leak out from the tissue. And again, they can become quite infected, they can become septic, and they can have osteomyelitis as well. If you haven't seen my treatment plan for osteomyelitis, there is a previous video that does show that, if you can scroll back into some through my videos. Now, again, if we were going to test for this too, we're going to swab it using the Levine technique, also a video that we have to show how to do that with the best technique, and we can determine what type of infection there is locally. So again, you can be diabetic and have gout, but the biggest treatment plan for them is to really have patients adjust their diet, to help them reduce their alcohol and beer consumption, to really talk about all the diet drinks that potentially that they're consuming, as well as, again, if they are eating a substantial amount of red meat and or shellfish, things like mussels, scallops, sardines, anchovies. You know, not many people are consuming those things nowadays, but there's still people, I'm sure, that are. So again, that is your primary treatment for gout. Again, it is not a diabetic foot ulcer. It can have the similar treatment if, again, the wounds or the tophi do open. But to be aware that, again, the uric acid is only really a test that's warranted when you're in, you know, your stage 1 of gout just coming in the inflammation stage. Anyhow, just remember, the best wound is a closed one, and we'll see you in the next video.